Hi, Morgan. This is Agnes. I would like to commend you for a discussion well carried out in your post. And I completely agree with you that addressing the social and emotional aspects of the patient, in this case, we have Miss Jachi, who's 45, and her mother, who has been diagnosed with breast cancer. So both of these are actually our patient at this point. And I would say that getting them to an emotional understanding of what is going on would give them the presence of mind to accept the diagnosis. And once they accept the diagnosis, then any planning for the treatment would actually go a long way. They are grieving. Both of mother and daughter are still in the bargaining phase, grieving, and they're trying to get in terms with what they are to face. And I would say that Miss Jachi's mother really presents with the typical symptoms of a depressed person, like she's crying too much, she doesn't eat, she don't sleep well, she keeps on worrying what's going to happen to her daughter if she's gone. And that's why in my post I said, like, for many people the diagnosis of cancer is like a death sentence because of so many different um, mindset that we have, people generally have, of cancer as a disease. So oncology might tell us differently, but this patient right here in front of us might not know that. So getting them established emotionally would be very beneficial to the patient and very helpful for the caregiver to plan a treatment for them. And to go outside of this, I think it's really not outside. Miss Jachi is 45 years old. And according to the predisposing factors about cancer, she hasn't been tested, or we don't have the story that she's been doing breast examination. In fact, she has not been doing breast examination. That's why she is concerned that there is nobody in the community teaching this. And to go back to what I was saying about Miss Jachi, is that the American Cancer Society and the American College of Obstetricians and Gynecologists actually put her age in the group of people who are at risk. And anyway, there's no harm in trying to do breast cancer examinations on oneself early, because we haven't ascertained what stage her mother's cancer is at. So maybe if it is advanced a little, then if it was caught earlier, it would have been a much easier diagnosis to handle, and the prognosis would have been better to understand. But all the same, there's nothing like it's late. No, it's good at this particular time that they have identified, this has been identified, and so treatment and counseling and teaching can begin. A job well done, Miss Morgan.